You know, not filling a prescription or taking a particular medication as prescribed, it can be so dangerous, and unfortunately, a lot of people actually do that. Medical non-adherence is actually a growing epidemic, and it's causing a lot of severe problems, health-wise and money-wise. Check this out. Have you ever been prescribed medication and once you've begun to feel better, stopped taking it? Well, many have, but that's not a good idea.
Medication adherence is simply taking medicine the way the doctor prescribed it. So the right dose at the right frequency for the right duration of therapy, then of course completing any therapy. We know this is a challenge for many patients, people with acute conditions, but also for those with chronic conditions. And we also know that if you don't take your medication the way that it's prescribed, you will not get the most benefit from it.
So if we all know that taking our meds as prescribed is the right thing to do, why do so many of us fail to do that? The number one reason? Money.
And we want to make people aware about some of the options they have available to them to offset that issue. For example, the discount card available at InsideRx.com, which enables patients to go online and download the card for free. They don't have to enter any personal information. It is available to give them up to 70% off cost of medication that's generic or brand, and they can use it at common pharmacies that they're familiar with, so your Walgreens, Walmart, CVS, etc. But ultimately, we want to make sure that they're aware of these resources because cost, like you mentioned, is huge.
And not taking your medication as prescribed can have serious consequences.
Nationally, it's responsible for about 50% of treatment failures, and it costs our healthcare system up to $300 billion every year.
And while your doctor should be the first person you discuss your medication with, remember that your pharmacist is a wonderful resource too.
If you have questions at all about access to the medication, affordability, or just generally how the medication is going to affect you, it is your health. So definitely self-advocate. Ask all the questions that you have. We are here to help you as your pharmacist and part of your healthcare team.
You know, another reason some people aren't taking their medication as prescribed, well, sometimes they simply forget. And that's actually the case for some elderly patients and some of our senior loved ones. So make sure you check with your family members to make sure that they are adhering to the medication as prescribed.